Good evening medicos, welcome to Medical Students Corner, myself Dr. Krishneswari. Today is Thursday and today we are going to interpret an investigation. So the investigation which we are going to interpret today is a most important investigation which is gaining more importance nowadays, and that is vitamin D. Today we are going to discuss about the formation of vitamin D, role of vitamin D, absorption of calcium, and also what happens when there is reduced vitamin D, what is the normal value of vitamin D, and also the sources of vitamin D. So let us directly go to the video. So about vitamin D, we all know that this vitamin D is a endogenous material, that is it can be synthesized by our body. From food materials also will be getting vitamin D, along with that our body will be producing vitamin D. So we all know that this vitamin D is produced by UV rays. What happens is, from the sun there will be UV rays, and when this UV rays comes in contact with the skin, when it comes in contact with the skin, there is a substance in the skin known as 7-dehydrocholesterol. 7-dehydrocholesterol. Okay, and this 7-dehydrocholesterol, by contact with the UV rays, it is converted to vitamin D. You understand? At the same time, this vitamin D will be absorbed from our intestine also. From our intestine also, this vitamin D is absorbed. And what happens is, this vitamin D is taken to the liver. Taken to the liver, and it is converted to 25 hydroxy vitamin D. 25 hydroxy vitamin D. Then what happens is, this 25 hydroxy vitamin D is taken to the kidney, and in the presence of an enzyme known as 25 hydroxy D1 alpha hydroxylase. 25 hydroxy D1 alpha hydroxylase. This 25 hydroxy D is converted to 125 dihydroxy vitamin D. 125 dihydroxy vitamin D, which is the potent form of, which is the potential form of vitamin D, and it acts as a steroid hormone in our body. And let us see the function of this 125 dihydroxy D, which is whose base is this vitamin D. So this 125 dihydroxy D, what happens is, it acts on the intestine. It acts on the intestine and it increases the absorption of calcium. Absorption of calcium. So whatever material which is rich in calcium you are taking, there should be vitamin D in our body, which helps in the absorption of calcium. You understand? Along with vitamin D, the hormone which is responsible for maintaining the serum calcium is parathyroid hormone. So parathyroid hormone, what it will do? It will be resorption. It helps in the resorption of calcium from the bones. Okay, so along with vitamin D, this parathyroid hormone, this both combine, and it is responsible for the maintenance of serum calcium. Understand? So we all know that serum calcium is very, very important to our body, our bones, our teeth, our heart, everything is what? Based on this calcium ions in our body. From this we understood that vitamin D is a very, very important factor which is necessary for our body. So we all know that the natural source of vitamin D is sun, is it not? UV rays. So nowadays what happens, the persons are sitting inside the room, inside the AC room, and they are working. Students are sitting inside the room and they are studying. So we are not in contact with sun. So UV rays, we are getting less UV rays to the skin and we are getting reduced vitamin D. So whether vitamin D is the only source of vitamin D is UV rays? No. Vitamin D, the natural products from which we get vitamin D, the most important thing is fortified cereals. In fortified cereals there is vitamin D. In fish oil there is vitamin D. In egg yolk there is vitamin D, and also in dairy products there is vitamin D. So these are the normal natural food products from which we will get this vitamin D. Now we will see what is the normal value of vitamin D. So we will be discussing the normal values according to the standard textbooks. So according to Harrison, the normal value of vitamin D should be greater than 25 nanogram per ml. 25 nanogram per ml. And if there is reduced vitamin D less than 15 nanogram per ml, what happens is it will be associated with hyperparathyroidism, because the parathyroid hormone, there is less vitamin D, there is less absorption of calcium. So what happens, this parathyroid hormone, it will be functioning or there will be increased function of parathyroid hormone, and what happens is there will be increased resorption of calcium from the bone, increased resorption of calcium from the bone. So the normal vitamin D should be greater than 25 nanogram per ml. And what are the symptoms of reduced vitamin D? Yes, when the vitamin D reaches below 50 nanogram per ml, what happens is the first there will be reduced bone mineral density, which leads to pain in the bones and joints. Then there will be proximal myopathy. Then what happens is the patient will, in the later stages, what happens is the patient will experience tingling and numbness, and in severe stages the patient may go for seizures. There will be hypocalcemia which leads to seizures. So this is the most important thing which is in concern with the vitamin D. And if some of the patient is complaining of joint pain, bone pain and all, you just think of vitamin D while doing other investigation also. Hope you have understand today's session. You are happy with the session. If there is any doubt, please let me know. We will discuss again. Thank you for watching. If you are happy, please subscribe, share to your friends. Thank you so much.